Hi, I'm Revati Kadirvel. I'm from Medical and Surgical Nursing Department. We are discussing in part 1 and part 2 videos that is about cholelithiasis. In part 1 we seen about what is cholelithiasis, what are the causes, what are the pathophysiology and all. Then second we seen types of cholelithiasis, types of diagnostic evaluation which is helps to find out the exact lithiasis in our gallbladder. Then today video we are going to see about medical management and non-surgical removal of gallstones and surgical management of removal of gallstones, and finally nursing management. So medical management, first, ursodeoxycholic acid UDCA, chenodeoxycholic acid, that is cannabidiol or CDCA. It acts by inhibiting the synthesis and secretions of cholesterol, thereby desaturating bile. Existing stones can be reduced in size, small ones dissolved, and new stones prevented from forming. 6 to 12 months of therapy are required in this method. Then medical management. The effective dose of medication depends on body weight. This method of treatment is generally indicated for patients who refuse surgery or for whom surgery is considered too risky. Patients with a significant frequent symptoms, cystic occlusion or pigment stones are not candidates for this therapy. Symptomatic patients with acceptable operative risk are more appropriate for laparoscopic or open surgery. Then we are going to see about the non-surgical removal of gallstones, that is dissolving gallstones by infusion of a solvent, monoactinin or methyl territoributyl ether (MTBE) into the gallbladder. Can be infused through a tube or catheter inserted percutaneously directly into the gallbladder. A tube or drain inserted through a tube tract to dissolve stones not removed at the time of surgery. An ERCP endoscope or transnasal biliary catheter. In the latter procedure, the catheter is introduced through the mouth and inserted into the CBD. The upper end of the tube is then rerouted from the mouth to the nose and left in place. This enables the patient to eat and drink normally while passage of stones is monitored or chemical solvents are infused to dissolve the stones. This method used when the size of stone not more than 20 mm in diameter. Extracorporeal shock wave lithotripsy, used for non-surgical fragmentation of gallstones, uses repeated shock waves directed at the gallstones in the gallbladder or CBD to fragment the stones. The energy is transmitted to the body through a fluid-filled bag, or it may be transmitted while the patient is immersed in a water bath. Converging shock waves are directed into the stones to be fragmented. After the stones are gradually broken up, the stones fragments pass from the gallbladder or CBD spontaneously or removed by endoscopy or dissolved with oral bile acid or solvent. Requires no incision, no hospitalization. Patients are usually treated as OPD, but several sessions are generally necessary. Then surgical management, laparoscopic cholecystectomy. If the CBD is thought to be obstructed by a gallstone, and ERCP with sphincterotomy may be performed. It performed through a small incision or puncture made through the abdominal wall in the umbilicus. Cholecystectomy. Gallbladder is removed through an abdominal incision, usually right subcostal, after the cystic duct and artery are ligated. Performed for acute and chronic cholecystitis. Drain may be placed close to the gallbladder bed and brought out through a puncture wound if there is a bile leak. Drain type is chosen based on the physician preference. So other managements of surgical management: choledochostomy, surgical cholecystostomy, percutaneous cholecystostomy. So those are other surgical managements. So we have to educate the patient in nursing management about managing pain. Sitting upright in bed or chair or walking may ease the discomfort. Analgesic medications as needed as prescribed. Report to surgeon if pain is unrelieved even with analgesic use. Resuming activity. Light exercise, walking immediately, shower and bath after 1 or 2 days. Drive a car after 3 to 4 days. Avoid lifting objects exceeding 5 pounds after surgery, usually for 1 week, caring for the wound. So resuming eat, resume a normal diet. Check puncture site daily for signs of infections. So report any signs and symptoms related to infections and all. Thank you.